Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. The number of confirmed cases of COVID-19 in the nation continues to grow. In North Carolina, there are 255 reported cases in 39 counties. Medical providers in Dare County continue to test patients who meet criteria for testing, which includes fever of 100.4 or greater, cough, and symptoms of respiratory illness. We have not had any individuals test positive for COVID-19 in Dare County. When we do have a positive test result, we will share that information as soon as possible. Yesterday, we shared that Hyde County reported an individual had tested positive for COVID-19. Later that day, Hyde announced that the individual wasn't a Hyde County resident and had been tested and was living in another county. The individual's identification card had not been updated and was showing the former address. It is important for the public to know that health departments across the nation have a system in place for reporting and tracing patients. The county where an individual currently lives is the county which should report and claim the case. If the individual has spent time in another county or counties, those counties would be notified so they can inform their public. The individual reported on yesterday by Hyde County had no affiliation nor had spent time in Dare County. Last night, I was chatting with my oldest son, a middle schooler, about COVID-19, what my role is as public health director, and what he thinks about how things are going. Our conversation drifted to the impacts on him, not seeing his friends, missing all his sports, and the upcoming online schooling that will start Monday. I thought the conversation was going well until I looked at his face and saw a little tear in his eye. It struck me then how important it is for us to think about what our young people are going through and how we can best help them navigate these very trying times. As public conversations around coronavirus or COVID-19 increase, children may experience increased anxiety and fear over a situation that can be difficult to understand. Parents, family members, and other trusted adults can play an important role in helping children make sense of what they hear in a way that is honest, accurate, and minimizes anxiety or fear. The CDC has created guidance to help adults have conversations with children about COVID-19 and ways they can avoid getting and spreading the disease. General principles to consider when talking to children include: remember that children will react to both what you say and how you say it. They will pick up cues from the conversations you have with them and with others. Make time to talk. Be sure children know they can come to you when they have questions. Remember that viruses can make anyone sick, regardless of a person's race or ethnicity. Avoid making assumptions about who might have COVID-19. Give children information that is truthful and appropriate for the age and development level of the child. Talk to children about how some stories on COVID-19 and the internet and social media may be based on rumors and inaccurate information. Remind children to stay away from people who are coughing or sneezing or are sick. Remind them to cough or sneeze into a tissue or their elbow, then throw the tissue in the trash can. Get children into a habit of good hand washing. Teach them to wash their hands with soap and water for at least 20 seconds, especially after blowing their nose, coughing or sneezing, going to the bathroom, or before eating or preparing food. If soap and water are not available, teach them to use hand sanitizer. Hand sanitizer should contain at least 60% alcohol. Try to keep information simple and remind them that health and school officials are working hard to keep everyone safe and healthy. Explain why your day-to-day routines have changed and how keeping safe distances from other people, other than family members, can be an effective way to help prevent sickness. If you do get sick, it doesn't mean you have COVID-19. People can get sick from all kinds of germs. It's important to comfort any fears by reassuring your child that help is available if you do get sick. Share that it will likely be a slow, staged progression back to normalcy. It is understandable that the outbreak of COVID-19 may be stressful. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and our community stronger. Children and teens react in part on what they see from adults around them. When parents and caregivers deal with COVID-19 calmly and confidently, they can provide the best support for their children. Parents can be reassuring to others around them, especially children, if they are better prepared. Not all children and teens respond to stress in the same way. Some common changes to watch for include excessive crying or irritation in younger children, returning to behaviors that they have outgrown, for example, toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating habits or sleeping habits, irritability and acting out behaviors in teens, difficulty with attention and concentration, avoidance of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol, tobacco, or other drugs. If you or your child or teen need help with the stress or anxiety you are facing, we have resources in our county to assist. Please call Port Health at 252-441-2324 or Trillium Health Resources at 877-685-2415. We are blessed to live in an incredibly special place with a caring and compassionate community. Together, we will get through this. As we move forward through this pandemic, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County Call Center at 252-475-5008. Thank you.